is the evaluation template I created to go along with my disablement project on ACL injuries. Starting off with the template, we'll go over kind of general information about the patient and the first 4 boxes, and then we'll move on to getting our subjective information and our past medical history. Next, moving to our objective section, we have a visual inspection. Now their location, I was kind of looking more towards kind of like what area is being affected from what you can see. And then swelling, ecchymosis, those are actual drop down boxes. You can't see it here, but when you drop down, it should be at least 3 different sections. No, it would be 4. And the kind of you can put on there if they have none, mild, moderate, severe. And I believe there is an option for complete too to put there too. So you'll just select which one you think is appropriate for that patient that you're doing an eval on, and then you'll move on to the last section that I have there, which would be deformity. And then that one would be an actual type in. So you'll type in if you see any deformities, where they are, what is it, and kind of continue moving on. We have patellar orientation. Now this isn't kind of just like directly for ACL injuries. This is just kind of like those general knee pathologies that I was mentioning before. So we have normal, patella alta, patella baja, or a camel sign. These are all check boxes. So if if you see multiple, you can select multiple. If not, you can just select one. Moving on to the next section. We also want to look at knee alignment, that genu varum, genu valgum, and then genu reconvatum. If you see that in the patient, we want to make sure we mark that down. And then I also have a section for additional notes. So if you want to add anything additionally to what you have seen in either the patellar orientation or the knee alignment, you can type that into that box, and then you can just basically put whatever you would like. Or if you want to add specific notes to what you've seen, you can also add that. And the next section, you want to go into palpation. And here I didn't give any like specific places to palpate on. I just gave a kind of like an area or a type box that you can put on, or rather if you want to just put the areas that you found to be tender to palpation through your palpation exam. Typically with ACL injuries, from what I found in my research, is that unless there's like another injury going on with it, you really won't find any true areas that are like tender to palpation. Like if they have like a bone bruise with it, MCL injury or meniscus injury, then you'll probably find some more areas that may be tender to palpation. But if it's just truly a sole ACL injury, you probably won't find anything else along with it. On to the next section, we will now go over our range of motion and manual muscle testing. So first one, I have knee flexion, knee extension, hip flexion, hip extension, hip abduction, and adduction. With these, we want to make sure we assess them in passive range of motion, active range of motion, and resistive range of motion. And I also have a section right here at the end that also allows you to put down what you found from your manual muscle testing for each of those motions. Now these are text boxes, so you can add like what you found, and then also if you had any additional notes, you can also add those in there. Right, and then the next section, we also have another text box right here that you can also add additional range of motions or manual muscle tests that you did. So let's say if you wanted to also do some ankle range of motion or two or something else like that, you can always add that in there. And then going on next, we have the clearance of the ankle and the hip. So you also always want to clear the next section above or below. And when you're trying to evaluate, trying to rule out pathologies or trying to rule out certain things, you always want to clear the section above and below it. And then you'll just kind of type here if everything came out fine, you just type that there. If not, you'll just go into details of your findings. Next, we'll look at our selective tissue test. Here I have listed some tests that are typically used to diagnose anterior cruciate ligament injuries. So we have, of course, our Lockman's test, anterior drawer, our Lilly's lever test, and then also a slocum drawer test. So in the next section next to that, you would put if you got a positive result, a negative result, or if you didn't test it. And then under that, we have other selective tissue test performed. So if you also think it may be another pathology going on with it, you can type that in here. So if you also think they may have like an MCL sprain, you can say you also did valgus stress testing. Or if you also think they have like a meniscus injury, you can say you did like a McMurray's test, athlete's compression extraction. You will enter that there, and then whatever result you got from it. Moving on, we have also under that our Ottawa knee rules. So kind of just have them there. You can read them as I kind of like go through what we're going to use this for. So this is kind of used for our referring strategies for radiographs being done. So if any of these kind of boxes check off in that patient, we're going to want to refer them out to get imaging done on that body part. And then under that, we have if radiographs were indicated, and we put yes. And then if you needed to type anything else, kind of where you sent them to, like where did you refer them to, you can type that right under there. Or if there weren't any radiographs indicated, you can put no. Then under that, we have our patient-reported outcomes. And I have named at least five different ones. Now, these are all scored out of 100, but they're all kind of for different knee injuries or knee pathologies. The first one, a knee injury and osteoarthritis outcome score. It looks at pain, other symptoms, function of daily living, function in sport and recreation, and knee-related quality of life. These are used, this one is used to just assess the changes in the knee pathology. It isn't specific to ACL specifically, but it just all overall looking at knee pathologies. The next one's the Technical Lifelong scoring scale. It looks at pain, instability, swelling, limp, stair climbing, and need for support. This one assesses the outcome for knee ligament surgery relating to instability. So this one would be a good one if you have a ACL tear and they are surgical case. This would be a good one to have for that patient. The next one would be the anterior cruciate ligament return to sport and injury. That one measures the athlete's emotional confidence, risk appraisal on returning to sports after ACL injury. Obviously, this one just assesses the athlete's ability to return to sport after coming off an ACL injury, which is another good one I would say to do if you have a specific surgical ACL repair and you are kind of like near those kind of like in stages and you want to see how ready they are to return to play. This would be a good test for them to take. The modified Cincinnati knee rating system. This one measures pain, swelling, function and activity level. This one is associated with knee function in general, but it was created for ACL reconstruction, but it can also be used for other knee injuries too. And the last one is the International Knee Documentation Committee Subjective Knee Evaluation. And this one measures knee symptoms, function, and sport activities. And this one just assesses knee pathology in general too. So depending on what type of knee injury you have would kind of lead you to whatever patient reported outcome that you would like to use. Next section would be the assessment section. And after that, we have our plan. Those two, you can just basically type what you want to type in those sections based on the patient's case. And then we want to have a next section of where if we refer the patient out. So it's either select the box yes or no. And if you did, or if you didn't, you would add any additional referral information if necessary. And then on the last page, there will be an area where you can electronically sign. And then here you would click or tap the date to enter. So when it pops up, it'll be like a date box and you'll be able to pick the date that you did all this on. And that is the end of my form. Hope if you do end up using this, it would be very helpful. The evaluation template I created to go along with my disablement project on ACL injuries. Starting off with the template, we'll go over kind of general information about the patient and the first 4 boxes, and then we'll move on to getting our subjective information and our past medical history.